Today we're going to be talking about facelift surgery, necklift surgery, and the different types of surgeries that are available for the face. I'm joined today with specialist plastic surgeon Dr Edinburg, who's actually from the Eden Institute, which is in Baulkham Hills, Chatswood and Richmond. And I discovered when I was here today as well that Dr Edinburg is also an amazing artist. He's got these incredible artworks and photography, and so not only is he a plastic surgeon artist, he's actually a other type of artist as well. So thank you so much for joining us here today.
It's lovely to see you. Thank you for coming.
Nice to see you too. Thank you. So tell me, I know that like a lot of people want to have a facelift procedure, but there's lots of different techniques with when people are having a facelift, and I know that you don't do a one size fits all, but tell us a bit about, you know, the way when you work out what someone needs, like maybe using me as an example.
Okay. Well, it really depends on what the patient presents with.
Mm-hmm.
So if the patient says, I'm worried about my jowls, or I'm worried about my neck, or I've got a couple of bags under my eyes, or my brows a bit dropped, so that's just a holistic assessment of what the patient has. And then you've got to hone in on what the patient actually wants. So let's say you want some jowls in your neck done, and I would consider this as a unit. I would not only do a facelift, a neck lift by itself, or just lifting the cheeks. This to me is a unit, and it's got to be dealt with as one operation. And then it depends on how I assess the patient, and then find an operation that will fit what the patient needs.
Okay.
So if the patient needs volume, we're going to replace volume. There are various ways of doing that with fillers, fat transfer, using your own tissue. And basically the different operations will allow me to achieve those kind of aims. So I think as a plastic surgeon, I need to know those various techniques, and I need to be competent in applying those techniques.
So if I came to you just wanting a neck lift, you'd say, I'm not just doing a neck lift because this is all one. It kind of starts from there.
That's exactly right, Trish. I think there are operations out there just to deal with the neck, but to me, if you've got a bad neck, it means you've got a little bit of this as well. And I think that to deal with this, you need to deal with that. So for me, I wouldn't only just do a neck lift, I would do a combination. And I would explain it to the patient, sit the patient down in front of the mirror, demonstrate to the patient what she would more or less look like when she comes out of the operation, and of course just show her lots of pre and post-op photos.
So if I came here, say with a girlfriend, we're both exactly the same age, but of course we've got different skin, whatever you do, you might say to me, well, this is what would be the best thing for you to achieve what you want, and my girlfriend may have something totally different to me just because of the way our skin is. And what about our lifestyle? Does that come into?
Absolutely. If a patient smokes, I won't do the operation on the patient, because there's nothing worse than having the skin flaps die because of from smoking. So they have to stop at least some time before the operation, and I'll check that because again, there's nothing worse than landing up with complications in a facelift. Sun damage, alcohol excessively, sun tanning, people go and sit under those machines, and so there's a whole lot of things. And of course, the most important thing is your genes.
Yeah.
So if you've got great genes, you've got great skin, you'll do well. If your genes are not great and you've got problems with your skin, you have to be careful.
And do you, like if someone is going to have a facelift with you, is there any preparation that they need to do before? Like, because I know that, you know, your skin needs to be in tip-top condition. Do you have like a prerequisite of things that they have to do before surgery?
Not really, but they do consult with our Medi-Spa staff, with Stacey and Tegan, who are really very nice, gorgeous girls.
Yeah.
So they'll see them before, and we'll put them onto the appropriate cosmeceuticals. They'll go under the heel light. But the most important part of all of that is really that they have enough information to make them feel comfortable about having a good operation. So they can come and see me as many times out. But to me, that's more important than all that kind of preparation.
Yeah, and I like that, the fact that, like what you said, because whenever I've had surgery, I've gone to the doctor, and then I have to have a think about it, and then I want to come back and see the doctor again. And so you're comfortable with people to come back and be really comfortable before they go ahead?
I think it's a priority in the practice that patients can come and see me as many times as they like. There's no charge for that.
Yeah.
It's my job to ensure that they have all that information, they understand the operation, understand the potential complications, and when they come to surgery, they should not be asking me questions 5 minutes before they get taken into the OR.
Because they've already had all their questions
Because they've
answered.
got all that questions answered.
And I think because it's the face, you want to get that, want to get the questions right the first time. Because you don't want to go in there thinking, oh my God, what am I going to look like when I get out of there? You want to know that you're, in safe hands and going to, look the best that you can look, and you know what's coming up, basically.
You have to be upfront as well. You have to tell the patients exactly, or not exactly, more or less, as best as you can, of what's going to happen, where the lines go, where the pull is going to be, the vector of pull, what the recovery is like. And the recovery is not short. It's by 2 weeks, I tell my patients they should be able to do most things. Drive, put on a scarf, go out for dinner, have a nice glass of wine. But by the time the sensation comes back, by the time the skin becomes soft, you're looking at about 3 months.
Okay. So how long a time before, so if you didn't want anyone to know that you were having a facelift, maybe I don't want anyone to know if I'm going to have one, how long do you reckon someone needs to be locked away for with your facelift?
I don't believe in that concept at all. I have patients who come in and say to me, I want my husband to know he's going overseas, and will I be all right in 2 weeks' time?
Yeah.
Well, if a potential if a complication happens,
yeah.
It happens.
So
you
true.
Can't hide from it.
Yeah.
And whilst complications are not common, they do happen. So you don't want to be found in that situation.
Yeah.
I mean, it's something that you've got to discuss with your partner and your family, and be prepared for those kind of things. So if a patient asks me questions, I want to hide away because of X and Y, so this is not a good idea. I don't think you should do it.
Okay, going to have to fess up on that one.
Fess up on that one.
Okay,
Yeah.
got to get around that one.
But in general, I mean, I see patients at a week. I see them at a week post-op the next morning, because I do this in hospital. I see them at a week, and whilst they may have some bruising down the neck, the swelling's coming down. If you want to put on some makeup, you put on a scarf, go out.
Okay.
You drive your car, go shopping, whatever, if you feel comfortable to do.
All right. So what's the different types of facelifts that you do? So you do a full facelift, which, where would the scarf for that be?
Again, that's variable.
Depends,
It's depending on what patients want. I mean, I'm very conscious when I do a facelift of not taking the sideburn and putting it up there, because to me it doesn't look nice then. So invariably I'll put a little cut just in front of the sideburn, down in front of the ear. Some surgeons make a little cut behind the tragus of the ear, but again, for me, it's like taking this skin, which is hard skin over here, and putting it over your tragus, and it's different skin. This is nice and soft skin. You can feel the difference. It's nice. So my cut just goes down in front of the tragus, and then and the scars heal really nicely up behind the ear, and then fairly high up, because you don't want to, when you go to your hairdresser, have a scar running across.
Yeah.
So you want it fairly high up, and then it goes into the hairline. Or I might even, in fact, put it in front of the hairline, have the patients wear their hair down without having it up.
Okay.
And then, of course, if you go on to do part of the brow, the cut goes up into the scalp.
All right. And with just a lower facelift, same thing?
Yeah, same thing. Well, this to me would be a lower face and neck lift. This would be a full facelift.
All right.
Yeah.
And there's a few different techniques. So there's the...
There are lots of techniques.
Yeah,
I
okay.
talk about different generations of facelifts.
Right.
But, so there is a skin only. There is a deep face plane lift, and there is the submuscular aponeurotic pain facelifts.
That's
I
the
tend to
SMAS one.
SMAS. I tend to do most of mine with a SMAS, and even within the SMAS, there are different techniques. You can cut the SMAS out part of it and stitch it together, or you can just imbricate it, meaning you just stitch it together. It adds to a little bit of volume in the face. But again, there are so many different techniques, and there's techniques where they just suture material goes in there, suture material in there, and it's all pulled upwards. Some people only make a cut that starts here and it goes up all the way there, and it all gets pulled with a vector in that direction. It's
Right.
a Tonard operation.
Yeah, right.
So again, there's you become a fay with these techniques. You
Yeah.
go and have a look at them, you learn them, you might do a couple, see how it turns out, and then ultimately at this stage of my life I can choose what I think is best for my patients.
And we'll finish up on this point as well, because I know that you've had a lot of experience, and you mentioned to me before about the very first time you ever did a facelift. You were really, really scared.
I was worried.
Yeah. So how do you feel, but what's the difference between then and now? Like,
Oh, it's actually mind-boggling what the difference is, because when you start off in practice and you know the theory but you're just really not 100% sure, and if you don't have a mentor standing with you and you're doing it by yourself, a little bit of worry. 20 years later, you have lots of knowledge, you have lots of wisdom, you have lots of experience, and that conglomerate basically comes together and says, this is a good operation for this patient. You get into the operating theatre with confidence, you can do the operation in a relatively short period of time with minimal complications.
Yeah. So it's all about experience, isn't it?
I would like to think so.
Yeah.
Like to think so. But, having said that, I know there are lots of young plastic surgeons coming out.
Yeah.
My advice to them is get yourself a mentor, do this operation with them, learn from them, and then just, do as many.
Yeah, absolutely. So, just get experience in what you've got to do and make sure you do it.
But that
do it
applies
well.
to anything.
Well,
Even
exactly.
applies to doing skin cancers.
Exactly.
You've got to know how to do flaps and grafts really well. I think it's just plastic surgery is such a wonderful specialty, because it has so many different aspects of it, from the reconstructive to the cosmetic, and being a plastic surgeon, you can meld those.
Yeah.
You can put them together and use different techniques for different things.
Yeah. Oh, that's been so interesting, so great. And thank you so much for inviting me in here today. It's been a real pleasure to do it. And I've got to say, I've just been out in the foyer, and Dr Edinburg is actually an amazing artist as well. He's got artworks out there. So a plastic surgeon who does art as well as art as a job, and art as a art as a living and art as a life.
Yeah.
So no, thank you so much. That's been great.
Thank you.
So if ladies and gentlemen, if you're looking for Dr Edinburg, you can find him at Eden Institute. You can Google it, or drop us an email to info@plasticsurgeryhub.com.au. Thank you so much.
Thank you.